Hey, good morning, Monstropolis. It's now 5 after the hour, 6 a.m. in the big monster city. Temperature's balmy 65 degrees, which is good news for you physical therapist assistants. And it looks like it's gonna be a perfect day. Maybe, hey, just in bed, sleep in, or simply talk about sex and gender differences. I'm Mike Wazowski. Hey PTAs, my name is Alejandro Garza, and I'm going to talk to you about sex and gender differences. To start off, sex is a biological differences. These are what you're physically born with. The doctor determines this by your genitalia, different from your gender identity. Gender is your own identity. This is what you identify yourself as, whether you're a girl, a boy, a female, a male. This doesn't have to go hand in hand with what you're born with. There's also people who are agender. This is where they don't identify themselves as either male or female. This is how you cut your hair, whether it's short, it's long, whether you wear tight clothes, loose clothes, however you want to dress, in a suit, in a dress. Well, the way you speak, the way you talk, this is your own identity. And there's differences in biological and behavioral differences when it comes to a male and a female. For example, male can be taller in height. They can metabolize differently. This is important later on when you're giving medication to a patient. Make sure you don't over medicate them. Uh, certain diseases can be susceptible to certain females, certain males. Males tend to be more aggressive. This is due to their testosterone levels. Females more prevalent for Alzheimer's disease, depression due to low estrogen levels during the reproductive years. And all this comes together when treating a patient in physical therapy or as a nurse. Let me give you an example. Let's say you knock on a patient's door, knock, knock. Hello, my name, Mr. or Mrs. My name is Alejandro Garza. I am your physical therapist assistant, and I'm here to treat you today. This can be simple in everyday situations, but when there's a patient who is identifies themselves as a different gender, then that may pose a challenge. How will you approach the patient? How will you knock when you come into the door? Um, if you take them to the restroom, how will the patient feel? If you're a male or a female, would the patient feel comfortable? Risk factors can be, like I said, over medicating the patient. If it's a female, if it's a female patient who identifies as a male, you don't want to make the mistake in over medicating the patient. Risk factors, all the risk factors could be false due to females being more impulsive as age progresses. Um, Without a gender-based prevention program or management, uh, the patients will be prone or more vulnerable to being mistreated. Patients will feel depressed, unwanted, or even offended, and start an argument with you because of the situation. Overall care would decline. There's new approaches or new ways of treating patients. Change therapy approaches. If a male with a male name, gender classifying as a female, approach the room by saying something like, "Excuse me, my name is Alejandro. I am from physical therapy, and I'll be working with you today." Don't be afraid to ask how they refer themselves by, whether it's Mr. or Mrs. Don't be afraid. Ask the patient, talk to the patient. Um, Maybe they just go by their first name. It doesn't matter, just ask them. And this is how you establish rapport. This is how you make the patient feel comfortable, and you'll have better outcomes in physical therapy. Um, on the other hand, if there's a, furthermore, if there's a male patient that identifies as a female, change therapy, treatments, or for example, when working with balance, if the patient doesn't feel comfortable playing baseball, which is more common for males to play, or football, then choose an alternative. Make suggestions such as tennis. You can play ball toss, maybe with a beach ball, or perhaps just a ring toss. Talk to the patient, ask them what they enjoy doing. Maybe they like watering the plants. Make suggestions to make the patient feel comfortable. These are alternatives that you can do, and these are all important. It will help the patient feel comfortable. It will help the patient's safety by administering the correct doses of medication, and it'll make the patient overall satisfaction. Thank you. I hope this helps you understand the differences between sex and gender, and you can apply this at your workplace. Remember, we're all here for the patient, no matter the sex, no matter the gender. We're all here for the patient.